各位线上的朋友们，欢迎回到2021天下城市高峰论坛。我们延续昨天的主轴，全球境界，从国际经验看见台湾机会。不过，我们今天呢，会把焦点放在医疗照护产业哦。虽然说疫情带来了许多的冲击，但也成为了科技研发的新契机。接下来呢，我们要带大家来到英国，看看这个健康科技公司 Kraydel 是如何借由一台电视以及他们的智慧平台呢，让在家里的老年人以及弱势族群可以跟在远端的家人以及医疗护理人员相互连结，达到远端照护以及关怀的目的。接下来呢，我们就要有请 Kraydel 的执行长 Dr. Amer Fasihi 进一步的来跟大家分享。Ladies and gentlemen, welcome back. And our focus today is the healthcare industry. And we're taking you to the UK today to see how the health tech company Kraydel, with just a TV and a little box, their remote monitoring system, is able to connect the elderly at home and their loved one and also health and care providers. To give you more details, let's welcome our speaker, Dr. Amer Fasihi, CEO of Kraydel.
Very, very happy to be presenting some of the views from Kraydel that we've gathered over the period of the pandemic. Our mission, as you can see here, is to improve the social connectivity and independence of older adults. This will give peace of mind to their family and enable better access for carers to deliver services. So during the pandemic, this mission is something that's become very, very important. As we know, the world over, shielding the vulnerable, especially older adults, became a very, very important element. And as various different forms of the COVID virus go through the world, lots of different regions, lots of different countries are going through various forms of lockdown. So our mission has become very, very important, and we've learned a lot about how people see technology, and particularly how they see the kind of service and the kind of system that we've put together of help to them as they're going through this lockdown. Or as they themselves are becoming very conscious and very worried about the way in which the virus could affect them. So people's behaviors have changed. And technology is a great way of helping them adapt to the new reality that the world finds itself in. And Kraydel, with our mission, is in a great place to help them address some of the concerns they have. So first, I'm going to talk a little bit about what's been driving our mission and how relevant it's become to the pandemic. As we know, the global population is aging and is predicted to double by 2050. So in only 30 years, there will be almost 700 million more people aged over 65 years. As we know, pandemics and new illnesses are going to continue to be a part of life for at least the next 5 or 10 years. And so we know that the aging population is going to have to address some of these challenges. And as you can see here, the effect of aging society is very, very different across the entire globe. The United States is going from 15% below 65 to 21%. China, you can see, is going from just 1 in 10 people to around 1 in 4 people being over the age of 65. So the way in which aging is affecting some of the major markets in the world is going to be very, very different. Africa will remain one of the youngest regions, while Europe, North America, and the major parts of Asia are actually going to age. As we know, viruses like COVID affect the aging quite fundamentally, and so technology is the answer to the way in which society is going to cope with the increasing age. So, what kind of problems do older adults face in today's society? And you'll see how these tie into the pandemic in a little while. So we know across the world that the healthcare system generally tends to be reactive. Only when there is a problem does the person facing that problem or their family reach out to the healthcare system. So anticipating issues and being proactive is very difficult and challenging for healthcare systems across the world. As people grow older, we know some of the issues that start to arise, and a better way of dealing with this is to anticipate those problems and make people more resilient and stronger before those problems are part of their lives. The second problem that people face is the adoption of technology. Smartphones, tablets, these are all very difficult systems for people to navigate because these aren't well designed for older adults. It's not that older adults have a problem with technology. It's that physiology of aging is very different. So, for example, circulation becomes something that happens less in the fingertips. So when people move to touch screens, the screens don't activate because their fingertips become quite dry. That becomes anxiety inducing because older adults can see younger children, younger people using these screens very easily, and they themselves are having a problem. Sometimes there's a tremor in people's fingers so that they hit the wrong app. Again, that causes anxiety because they feel that they're not able to operate the system properly. It's also relevance. Sometimes older adults don't feel that they need to use the technology as much as the younger generations do. And that in itself means that adoption is something that doesn't happen. So this is a major challenge when we position technology as a way of addressing aging society and some of the pressures that the pandemic has given us. The way in which technology is designed needs to be much more for older adults. There's also inequality around accessing technology, and governments and societies in general will have to deal with that. There are huge disparities in certain countries, and for much of the world, it seems like those disparities are going to continue. So making technology available to different sectors of society is very important. And then finally, isolation. As people become older, their mobility reduces, their confidence in driving reduces, so they become less accessible. They're able to they face more challenges accessing different types of activities around the world in their local communities. And so around the world, older adults end up being far more isolated. So these are some of the problems that older adults face. These can all be addressed when you put the older adult at the center of your solution. By doing that, there'll be huge opportunities that emerge to address some of these challenges. The importance of aging healthily, that will become more and more of a cost economic problem, with people anticipating problems and trying to solve them before they become crises. So better physical health, better social connectivity. The impact of loneliness on health is very well understood, and it's a huge burden. So we need to address some of those issues. The importance of understanding the difference between health span and lifespan is very important. Lifespan is just how long somebody lives. Health span is the amount of time that they spend living healthily before they have a limiting disability. And those are significantly lower than lifespan. As you can see here in the second bullet point, health span is 62 years for men and 61 years for women. And that's in the UK, where life expectancy is in the late 70s and early 80s. So the latter years for people who grow older are quite hard, with facing different types of health challenges. And there needs to be a way we can anticipate those. And if we can anticipate those problems, there'll be huge opportunities. So some of the trends that are driving global awareness to help people age healthily include reducing health and social care costs, shifting the focus to health span and healthy aging, growing awareness of the effects of loneliness, and reducing the care burden on informal carers. If we can address some of these issues, then I think we believe that there is going to be a huge impact and massive opportunities for companies that are bringing services and systems to market that address each of these points. Coming to the pandemic, So what we've seen so far is that there is a huge growth in the number of older adults. We recognize that there's a huge opportunity there. And you can see how the pandemic has driven huge changes. Now, this data is just from the United States, where there's been a lot of in detail analysis, and it's from the AARP. So what we see here is that the pandemic has driven adoption of technology that exists hugely. So first of all, the spending of the individuals and how much money they spend on technology has grown almost 2.5 times. And they're spending it mainly on smartphones, on better TVs, and on better ways of hearing, so earbuds or Bluetooth headsets to understand and see what's on the screen. Secondly, people are using video chats to increase their social connectivity, which is fantastic. So you see 45% increase in the amount of video calling. Texting is increased almost by more than a third, and almost a quarter more emailing is happening than was happening before. So it's and this point, the second bullet point there, in terms of 2019, about half of people over the age of 50 had never used video calls, but by 2020, 70% have, and 1 in 3 are using video chats weekly. This is a huge driver of technology adoption. It's huge evidence of technology adoption, and this is exactly what we thought the pandemic should be prompting people to do, and the data is now showing that technology adoption is taking place. Now, despite the design issues that smartphones and smart screen technology have, the use of smartphones has increased, and it's gone into that whole area of why should I use technology? A lot of older adults say that they don't need to. Because of the restrictions in the pandemic, they've been forced to do that, and that has driven the grocery orders, online grocery orders, going from 66% in older adults to 24%. Personal health access, so via technology to do telehealth visits, renew prescriptions, or to book appointments, has gone from 28% to 40%. And the weekly use of streaming services has increased by 58% to 58% from 44%. So these are huge areas of growth in terms of adoption. Now, what are the barriers that are still being faced? So mainly the cost is, so the top 3 are listed here. So cost is at the top. And you can see that $394 per year to $1,144 is quite the increase. So cost is clearly a major concern. Still, more than a third of people don't understand how to use the technology. So a lack of awareness and knowledge of what's out there and how to adopt it is there. But then there's a vast amount of people. So 83% of people who have recently adopted internet-based technologies feel that they may not be private when they're online, and that comes from a lot of the tech companies having very poor reputations in terms of confidentiality, and particularly some of the issues that have taken place around data breaches and how people are harvesting data, how some of these companies harvest data. That really has caused a huge barrier and a concern around how widely to use these technologies. But overall, putting the barriers to one side, there's been a huge increase in the amount of technology that's being used, what it's being used for, and how widely it's being used. And those are all catalyzed and being driven by the restrictions that the pandemic has imposed upon the world. Now, as I said earlier, this data is from the US, but we don't expect it to be very different in other countries. There's generally a trend towards these kinds of numbers, and in certain countries, obviously, they'll have much higher adoption rates. So what does this mean for a company like Kraydel? Well, our system uses existing technology. So we use the TV to enable video calls. Now, it doesn't have to be a smart TV. It just needs to have an HDMI port. Our system, you can see on the left-hand side here, has a remote control. It has a yes/no button and the user can simply open the interface on their TV using our home button. Our system takes over the TV automatically. They don't have to switch HDMIs. And the user simply has to answer the question that's on the screen with a yes or no. They will be asked, would you like to make a video call? They can say yes, and then the directory of contacts opens up, and then they can call whoever they want to from that directory. If they choose not to make a video call, they may be asked, they'll go to the next menu item. Would you like to view your photos? Or would you like to use view your videos? Or would you like to use your services? So it's a very, very easy system to adopt. It's designed specifically around people so that they don't need to have training. And none of us who use smartphones and tablets regularly expect to have any training whatsoever when we start using different apps. We believe those things should take place. They should be intuitive and very easy to adopt. And that's what we've designed here, a system that people can adopt without any training. Secondly, to make video calls to users' TV, their supporters, so this is people in their network, and that would be 8 to 12 people, we think. They may include doctors, social care workers, family and friends. They download the Connect app onto their smartphones, and then they can make a video call from their smartphone in exactly the same way that they would use WhatsApp for example. Now, because the user only has a set number of people within their support network, and anyone outside of that support network cannot call the user does not get sort of random calls from strangers or people that they don't know very well. They can only get calls on their TV from people who are in their support network. So again, we're trying to address that concern around privacy and to safeguard the older adult and just keep people who they are familiar with and who they know calling through their TV. Now, what makes our system unique is that we, in addition to the social connectivity, so we recognize that social isolation is something that's a huge challenge for society as it gets older. We also recognize that their families and people who are connected to them need peace of mind. So what sets Kraydel and our offering Connect totally apart from any other system that's available today is the fact that we have social connectivity to address isolation, but we are also a fully fledged IoT platform. So we have connected a range of sensors and devices, some of which are integrated into the system that you see on the left, but some are standalone Bluetooth devices that are integrated and automatically pair with our system, and they send the data through those devices, from those devices through our hub onto the dashboard that you can see. So we integrate the data from a range of different devices, and these are all third-party devices. These aren't devices that we manufacture. These may be blood pressure monitors, glucose meters, wearables, weighing scales, any kind of device that has a Bluetooth connection. We can pair that, and that data then gets displayed on the Connect dashboard. So on the left-hand side of this slide, you can see what the system brings to the user, which is better access to their friends and family through better social connectivity and video calling through the TV. Also, friends and family can share photos and videos so that the user can see those on the TV. Those are social connectivities on the left-hand side. And then we have peace of mind through the IoT platform on the right-hand side of this slide. And as I said earlier, Connect, our system is called Connect, is the only system that brings IoT platform and social connectivity together through the TV. And that's what gives us this very unique positioning. There are a very wide range of offerings out there, and they're all fantastic. And we think that there's going to be a major positioning for all of them, especially as the market is growing so fast. As we've seen, the number of older adults around the world is going to double. But what you see here is that the system that we've developed is really unique in that it brings social engagement, remote monitoring, and support around medication and management together, so that you actually have a health management system that is run through the TV. Doctors can make video calls through the TV. They can, and nurses can, and they can call the user. They can see the user sitting in front of the TV. They can see their body language. They can see their room. They can also capture data remotely from devices that the user may be using, and they can therefore start to anticipate where some of the problems are because of the richness of the data that they're starting to gather. Feedback has been fantastic. We've got 99% of healthcare practitioners saying that they would recommend the system and they would use with their own family, and that they find it very, very easy to install and operate. And then from users, they found it that the TV-based system is so much easier to use. 72% said that they found the Connect system very effective, and only 14%, 9%, and 5% respectively used the existing technology. So it's a very widely accepted system. The service providers, such as healthcare and social care providers, are adapting to it very easily, and we've got very positive feedback from users and their family. And you can see that here, that around 93% people who use Connect said that it was easy to use, compared to the 23% or 16% who cited the tablet or the smartphone. And around 2/3 of users saw an increase in contact time with the people they love, and they said that their family felt that their peace of mind had been improved. So it reduced loneliness and isolation. And this is really what we're trying to do. We're trying to deploy our technology to address some of the issues that the pandemic has raised around isolation, around virtualizing healthcare delivery. And what we're seeing is adoption amongst service care providers, as you saw in the last slide with healthcare providers, and you're seeing adoption and engagement by users and their family. And we feel that a lot of the motivation to adopt this technology has been driven by the pandemic and the pressures that lockdowns have forced on people. So we're seeing a lot of activity in the UK. We're a UK-based company, and so a lot of our discussions are taking place with UK-based parts of the society, so care providers. You can see a lot of NHS logos here, but then we're also dealing and being contacted with by a lot of international companies as well. And we're very pleased that there are some very interesting conversations that are taking place where people are seeing how easy our system is to use and how widely they can adopt it. So key messages on conclusion are that the pandemic has driven a very large level of adoption amongst older adults of technology to enable the delivery of healthcare and to delivery support for social care. While there are some issues around the design of the system, older adults are far more open to adopting technology. Our system, the Connect system from Kraydel, is the only TV-based platform that combines social and connectivity with health and well-being support, and it's the only one that's been designed specifically for older adults to use through the TV. We're making good progress in the NHS in the UK and with care providers, and we're very interested in talking to international partners. And we're seeing some very good outcomes from some of the ways in which we're working. So on that note, take your lead, and thank you very much for your attention.